Joining us today on Real Health are Tony Award-winning actress Phylicia Rashad and Dr. Peter Sheehan, director of the Diabetes Center of Greater New York. They're here to speak to us today about peripheral artery disease, that's P.A.D. for short. Dr. Sheehan, Ms. Rashad, welcome to Real Health. I'd like to direct the first question to Dr. Sheehan. What exactly is P.A.D.?
Well, P.A.D. refers to peripheral arterial disease, and this is a cardiovascular disease that's caused by the buildup of cholesterol or plaque on the arteries that feed the legs. People can have symptoms generally during exercise, pain with walking that's relieved by rest. That's one of the first signs that someone may have P.A.D. Most people, however, have very subtle symptoms or functional problems, such as they can't walk as fast or can't walk as far. Things they attribute to getting older and may not even realize they have a significant underlying cardiovascular disease.
Okay, all right. Now, Ms. Rashad, you had 8 family members who exhibited risk factors for this condition.
Yes.
What do you remember of them growing up, as relates to this health condition?
All of them had diabetes.
Mm-hmm.
And of those who had diabetes, all of them died of either heart attack or stroke. And I remember my father having cramps in his legs and his thighs that we thought were Charlie horses, because he was a dentist and he thought it was because he was standing all day for so long, so many years. And one of his sisters had toes amputated. There was poor circulation in her feet, and they amputated her toes. She died of a heart attack as well. Well, these are symptomatic of P.A.D. P.A.D. can often result in loss of limbs, loss of lower extremities. Recently, a friend of mine called me and said, "I'm maxed out, they want to take my leg." And I called her and said, "What are you talking about?" She said, "Oh, they say I have P.A.D. Well, her risk factor was smoking. That's a serious risk factor. Diabetes and smoking are the 2 most serious risk factors. This is what Dr. Sheehan told me today. And my friend is evidence of this. So she had been smoking for years. Nobody could get her to stop. Intelligent, educated, professional woman. And she had developed a problem with her toe. She had gone to have a pedicure or something, and this little infection set in, and it never cleared up, and it was getting worse and worse and worse. When she told me she had P.A.D., I said, "Have you talked to anybody from the P.A.D. Coalition?" She said, "No, she was just in a state." Well, because of my work with the P.A.D. Coalition and the P.A.D. Make the Connection campaign, I knew to call this gentleman who was able to help her out a lot, and she didn't lose her leg. She had the toes that were gangrene had to go, but her leg was saved. And if she had known about it earlier, she said, didn't she say she had some symptoms earlier before this infection where she felt her legs were cold?
And heavy.
And heavy. And this was a woman who golfed and played tennis. You see?
Okay.
So, but she didn't know, like most people don't know about this condition, that those were symptoms. That something is wrong here.
Okay. All right, I'm going to go back to Dr. Sheehan very quickly. Could you tell us the difference between risk factors and symptoms?
Well, risk factors would be the conditions in which P.A.D. will appear.
Okay.
The most powerful risk factors, as Phylicia mentioned, are diabetes and smoking. The other risk factor is just aging. So if you look at people over 50 with diabetes or smoking, or people over the age of 70 years, about 20% will have P.A.D. when we do the diagnostic test.
Okay, all right, Ms. Rashad, back to you. You are going to be traveling to several hotspot cities. It all came out of the campaign research that was done and identified these hotspot cities. You've been watching Real Health. Ms. Rashad, Dr. Sheehan, thank you for spending time with Real Health.